Absolutely, sir. As you have rightly said, I feel that, what we say, ignorance is bliss, which actually interpret when the child is suffering. For the simple reason, the child is ignorant. You tell them, okay, you'll be all right, and he is convinced. He gets convinced, he or she, whatever may be, that yes, I'll be all right. Whereas in adults, at the core of their mind, they feel that no, I won't be all right. Only this just now maybe quality or maybe I'm only few days are left. Whereas a child, you can convince, and once you are, as you have rightly said, that once he is psychologically prepared, his tolerance even to the treatment and facing the side effect is also better. So this is a positive part, I should say, and that one way really how you can put his mind to work and really get a better result is, I think that a child is a better patient than the adult, if you go to see.
Yeah. Actually, you have to pointed out the right thing. When an adult comes into a consultation to look at the doctor for looking at the results of the scan or results of the test, they are very apprehensive. Like, what is the doctor going to say? Is going to be a good news or bad news? But when a child comes into my room, it is the parents who are apprehensive. The child is always looking for, when are you going to give my chocolate? Okay, they are just waiting. Finish your examination, give my chocolate. They are happiest coming to see me. Well, the parents are much more apprehensive of what I am going to say. But as far as the child is concerned, only thing they are interested is the chocolate I am giving.
So that is one way. Means that's how you establish a good rapport with them. And in fact, I think that is one of the secret of success, because once you tell such child, okay, you'll be after 2 days you'll be able to go to school, or your holidays will be starting, then I will show you some Disney games or whatever video game. They are convinced. Whereas the adult, he has called preoccupied, pre-filled mindset, and that he is not ready to accept your thought process, because unless his cup is empty, you cannot pour anything new. So whereas the child has got a very receptive mind. Doctor, I would like to know, when you are, such type of patients are there, when you face day in and out, I should say, because you are a pediatrician, lot of apprehensions are there, lot of myths are there among parents and relatives. What are the myths commonly carried over, and how to cope up with such crises, and how to face the challenges as far as oncology is concerned in a pediatric age group?
The first myth is that the cancer is fatal. Okay, when we say, they tell it's a cancer on the society, word is used because cancer is used such as a bad thing, that it is incurable, that it is something bad. The first myth which you have to remember is cancer is curable. Okay, it is in pediatrics, it's one of the most curable diseases. There are a lot of other diseases which public think are better, but actually are less curable than cancer. That is the first myth. One is cancer, that cancer is fatal. It is not. Cancer is curable. And the second myth is cancer treatment is painful. Okay, which it is not. Okay, there are lots of treatments, and even if they are painful, now there is lot of supportive care. That means we have got good painkillers, we have got good anesthesia, good supportive care, which can
take care of
the situation and reduce the side effects. Okay. And the third thing we have to remember is that the cancer will have some long-term side effects. That means, like, what is going to be, even if after we cure cancer, there is a stigma attached to it. Other thing we have to remember is, now in the pediatric oncology world, nobody is trying for a cure. That is taken as granted, accepted. Okay, so nobody is going to pat me on the say, if I say cancer is curable in a medical conference, they will laugh me out. Okay, what is more important now is not the cure cancer, that is accepted, is to reduce the long-term side effects. Okay, now what we are trying to is reduce the cost of treatment. When I say, I am not talking about the financial cost, but the medical burden. So now the treatment is actually to reduce the side effects, how to make the treatment more comfortable to the patient, and how to reduce the long-term side effects, like how to reduce hair loss, how to reduce the infertility side effects, and how to reduce the pain. That was the aim of the today's. It's not the cure. Cure is accepted.
Means there is nothing
there is no discussion on cure. That is accepted. In pediatric oncology, the aim is to reduce the side effects.
Even the cost saving part, because all the time, all the places, it may not be feasible for the parents to come to the center, and so whatever newer things are happening are around, focus around this. Now I want you to touch this aspect, that what newer things, what you are aiming at, your objectives, or your touch, or you have achieved, or you are in the process of achieving.
Now the aim, the last drug which was used for the common drugs which we use for treating leukemia was discovered 50 years ago. You won't believe that we are using 50-year-old drugs, but what has changed is how we use it. Okay, there is a lot of fine tuning going on to when to use it, how much to use it, and changing those things to get better results. Okay, and most of the improvements in leukemia, like pediatric acute lymphoblastic leukemia, is taken as the example of success in oncology.
I see.
Okay, how other cancers should emulate treatment for other cancers, and the most of the progress has been in the fine tuning, because we have got the gross tuning right already. So now it is to fine tune it to make it even better. That is one thing. And also now with more modern development, there are a lot of supportive care has come in. Okay, we can treat infections better. We can give much more support. We can give medicines to bring the counts up. And then we have got better symptom control drugs. So actually the burden of treatment has come down. Okay, while as earlier days the cancer used to be a rigorous treatment, now the burden is, it is the same rigorous treatment, but the effect is taken out because the side effects are managed very well, so that in improved supportive care, now the treatment has become much more tolerable.
That's good. That is one fact, one we can say is a good achievement.
Good achievement.
Yeah. Sir, why I would like to know, sir, now we are talking about newer things happening, like something like nanotechnology or drug delivery system. How much role does it have, first of all, and how much things have been achieved in a country like India? Okay. Or at your place, because yours is a specialized center, but still I think that you have a lot of branches, and that means people, means accessible. I don't say directly to doorstep, but at least, okay, within the reach. So what are the newer things as far as drug deliveries are, means have been achieved?
Okay. Now for some cancers, what we call is called targeted therapies. Yeah. That means when we give some drugs or when you give radiotherapy or surgery, the main thing is it affects the cancer cells, it also affects the normal cells. Okay. So now what we call is the targeted chemotherapy, where the drug goes and attaches only to the cancer cell. Okay. So that they do not have any other side effects. That is one of the development, and that is where all the progress is going towards, to get targeted therapies for as many cancers as possible. And the other development is the organ conservation. Earlier it used to be, if you have a cancer of the part, treatment used to be cut that part out. Now it is not to cut that part out, cut only the cancer out and keep the organ. Okay. So this has been like the extreme example which we can see is the bone tumors, where in osteosarcomas, earlier it used to be amputation of the leg, used to be very common treatment. Nowadays it is like no more used unless absolutely necessary. Now the aim is to only give chemotherapy to reduce the size of the tumor, make it surgically resectable. That means only the tumor to be removed and to preserve the leg. So the one is targeted therapies, two is the organ preservation. Now we are going more and more towards preserving the organ, preserving the function. Whereas in retinoblastoma, earlier the most of the treatment used to be retinoblastoma is an eye tumor to take out the eye. Nowadays, we are giving chemotherapy, and with more modern treatments like laser therapy, coagulation therapy, radiotherapy. Now the aim is to reduce the size of the tumor by giving drugs, and then give some local treatment and to preserve the eye and also to preserve the function of the eye.
I see. So these are the, definitely we can look optimistically for the future. So one more thing I want to ask you, doctor. See, when you are dealing with such patients in your clinic or in your hospital, what are the most challenging situations you feel that, oh, this can be coped up, but they arise? Like, see, parents feel, okay, now what is going to be future? And as you have rightly said, the children usually they are more acceptable to your suggestions, and once they are convinced, yes, he is my doctor and he is going to take care of me, they get it. But as far as family members or psychological support system, because in adults they have got psychological as a onco-psychologist, do you have some setup like that for the family members? I would just like to know.
I think the usual problems are the social problems which are more difficult. The medical problems are the easier ones to tackle. The social problem is the social stigma attached. Okay. Usually parents say, sir, we want to leave letter for the school saying that the child cannot come to school, but don't write it is cancer. So one is because there is still a social stigma is attached to cancer. If a child has got cancer, they don't want the other people to know that their child has got cancer, and that cuts off all the support systems. Okay, the school would have otherwise been helpful, they would have provided home education, but because the school is not
aware that
and the parents are actually stopping that information. Same thing, they won't tell their relatives, where their relatives could have helped with the other things, they keep it. So still a social stigma is attached to cancer, and they think, will my child get married later in life? This, if I tell them that my child has got cancer, it will affect their marriage
future,
prospects in the
Marriage,
future.
yeah.
So this is one of the main things which come up, which they want to keep it as a secret. Okay, that is one problem which cuts off their support systems which could have helped the family. And the other thing which is of course the finances. Okay, as the more and more modern treatments are coming,
Yeah.
the cost also escalates.
Yeah.
So the other aim should be to not only to reduce, we have reduced the medical burden, we have also to see how to contain the cost.
Yeah.
Okay.
Yeah.
The aim to which we, and also the psychological support, as we were telling, we have got the family counseling and psycho-oncologist who will counsel the whole family. Whereas in adults, the patient needs the counseling. In my patients don't need, the families need counseling.
Correct.
Patients are fine.
Yeah, that is a good part of it. Sir, now when we look at especially country like India, and where most of the facilities are available only at the top cities, not in all cities also, like say like you have in Bengaluru or Mumbai or Chennai. How, when you look at this problem at the national level, how you feel that this issue can be addressed and can be taken care, at least in near future, if we go ahead with certain proper way of handling this situation? Because though the facilities are available, they are only at limited places. So how to make these facilities available to the public and make public also aware that okay, such facilities are available, not just on a global issue, and at least a national issue, I should say. In short,
I think because pediatric oncology is a very specialized subject, it's only present in very few big cities. Okay, but what we can do is what we have called a shared care. That means the main part will be done in the main center, but the rest of the treatment can be continued at the tier 2 or tier 3 cities.
I see.
So we have tie up with pediatricians, not even oncologists, pediatricians who can continue the treatment. The first initial treatment is given, then we give out a plan, and the pediatrician can continue the treatment with telephonic support. So if there is any problem, they can all, we are at the end of the phone. And the other thing we can do is with the modern technology now, Skype, electronics, email and all, we have got lots of patients whom we have seen only once. But we are in constant touch, and the local doctor is continuing the treatment with our guidance, with our plan. And this has been rolled out even on international level. We have got international patients who are taking the treatment plan given by us, but being implemented in Africa.
I see.
Okay, and it's very easy with electronics. All they have to do is to text you a time, and we are on Skype, and we can come put. So the main now component is to, the expertise is limited in few places, but it can be spread across the country by using modern technology.
Correct. Means it can be, the knowledge can be percolated, and all people can be beneficiary. And you need not be very techno-savvy with these mobile phones and whatever you have applied. I think a lot of things can be achieved, and we can hope that the future will be bright. In a nutshell, I want you just to give a take-home message before we wind up this program.
I think the take-home message is, one, the children's cancer is not that uncommon. It happens. And when it happens, when it is picked up early and treated well, it is curable.
Okay, thank you very much, Doctor. Really, you have taken a lot of efforts to address this issue, and especially address people of Goa on this very touching subject, actually, and more very sensitive, because as you have rightly said at the initial only, that when a child is affected, everybody collapses, especially full family. It is not just one individual as it happens in adult age group. Sir, thank you very much for sharing this information and knowledge with us. On behalf of all the viewers and Prudent Media, I thank you very much. So nice of you. God bless you.
Thank you.